Okay, so today I'm going to be talking a little bit about administration of the FDA-2 assessment. So, for the FDA-2, I'm going to go ahead and read this quick paragraph out on my administration manual because I think it has some good information. So it says the FDA-2 can be administered in approximately 30 minutes by qualified personnel. This test is divided into 7 sections: reflexes, respiration, lips, palate, laryngeal, tongue, and intelligibility. There's also an area on the rating form for recording influencing factors. It is suggested that each section be tested in the order shown on the rating form, but it is not essential. It is important to test each item within the section in the order shown. Okay, so those are some of the key instructions. And then also, when administering this test, you're supposed to make sure that you're only noting the second attempt done by the patient because the first attempt should be practice and them getting used to what's going on. If you do go in for a third time, or sorry, if the patient goes in to do the test for the third time, then you don't count that one. You count only the second attempt. Okay, so moving on, there's different categories within, I'm sorry, this camera is not good, but there's different categories within the rating portion. So there's reflexes, respiration, lips, palate, laryngeal, tongue, and then intelligibility. And each of these different sections have little subsections under them, and that's where you're going to rate your patient on the scoring. Okay, so going into the scoring form, there is a scale from A to E, with A being normal function and then E being no function. So when you go to score for this patient, you're going, or whatever patient, you're going to figure out where you think their scoring would be. And then it's almost like a bar graph, the way that it all tends to fall out. And I'll show you a picture, 1 second. So this is how it looks in the manual. That's a completed one right there. So since this patient got a B right here, they filled it all the way up to B, and that's their score on the cough reflexes. And then also on the manual, there's an influencing factor section where you can write their hearing, sight, teeth, language, mood, posture, rate, sensation, subjective report. So any extra notes that you have, you can make on the side about those things. And then there's a summary part down here and also recommendations right at the bottom. Okay, so interpreting the results is a little bit confusing, so I'm going to try to explain this in the best way that I can. So there's a section in the manual, and it's pages 29 through 32, and it correlates the way that a patient scores with different types of motor neuron lesions. So group 1 is upper motor neuron lesions, group 2 is mixed and lower, 3 is extrapyramidal, 4 is cerebellar, and then 5 is lower motor neuron. And they show you patterns that are consistent with each of these groups so that you can look at your patient's score and then understand where they would fit within these 5 categories. So the reason why understanding these different motor lesions are important is because it can give more information onto which type of dysarthria the patient might be experiencing. Okay, it got extremely dark all of a sudden, so I had to move and charge my laptop and turn the lights on. But anyways, I wanted to add one more thing. So when we're looking at the motor lesions, we're more so looking for like the shape of the bar graph to interpret those results. However, when we are planning treatment and therapy, we can go back and look at those individual deficits that the person is experiencing and then work on those in therapy. to begin on the words section, we're going to shuffle up these cards. And we need 12 cards overall. So there's 6 on each full page. So we're going to start by showing him one of these. And then the first 2 cards are just for practice. So we're not going to note those in our scoring, but those will help expose the patient to what's going on. Can you say this one?
Yeah, choice.
Okay, and then as he says it, I'm going to transcribe his speech on my notepad. All right. Can you say this word?
Salary.
All right.
Gaze. Bureaucracy. Wash. Majority.
Okay. And then we're going to move on with another one. Can you say this word for me?
Patch.
Okay, we're going to do the exact same thing again, but with the conversational cards. So I'm going to shuffle these up. And then ask my patient to read these out loud while I transcribe his speech.
Trying to shine.
Okay, so then with conversational task, we're doing the same thing again, but I'm just going to ask my patient to tell me a little bit about something he's interested in, and they give some examples like jobs, hobbies, relatives, etc. So I'd say something like, tell me something you're interested in. And then he'd start telling me, and I want to make sure I get 5 minutes total of conversation in his speech. So some pitfalls specifically as an SLP would be giving like auditory or verbal cues without meaning to, but it's just kind of like an instinctual thing. That could be with any assessment, but it could sway the results of this assessment as well. And then, particularly for this assessment, if you're around a patient constantly and you get used to hearing their voice, they may be intelligible to you as the SLP, but not to other people. And so that can skew the voting as well. Or not the voting, but the scoring. Okay. I promise this is the last recording. I've changed 3 outfits at this point, so I apologize. Okay. So, the main pitfall that I could think of, and there weren't a lot that really came to my mind, so the ones that were kind of on the back end I didn't include because it more so was a pitfall from the clinician rather than the patient. But if the patient is experiencing like anxiety about actually taking the FDA-2 or like participating in the FDA-2, then that anxiety can affect the motor demands and motor output. And if they're already having difficulty with the muscles and the motor output, and then you add the anxiety on top of it, that can make it appear worse than it is in the scoring.